is Monsi Shaw. I'm one of the thoracic surgeons here at the University of Kentucky. As a thoracic surgeon, I take care of primarily diseases involving the chest, not including the heart. So that includes things like lung cancer, esophageal cancer, mediastinal masses, as well as benign disease such as lung infections and things like that. I also take care of the upper part of the abdomen, known as the foregut, so things like paraesophageal hernias or hiatal hernias, reflux disease. One thing I try to keep in mind is that, this is scary for patients, or it very much can be. Seeing a surgeon or talking about having to undergo an operation, that can be stressful. And so my primary goal is to, work with the patient and be an ally for the patient to A, explain what's going on, because sometimes that's the first place to start, and then B, kind of make the process as smooth as possible to decrease that stress that's related with whatever's going on. A lot of what I do is through small incisions, which means less pain and shorter times in the hospital. I think most people, when they think of thoracic surgery, they're thinking big incisions, they're going to be split wide open. But that's the great thing about how medicine is involved, and most of what we can do now can be done through 2, sometimes 3 small incisions. So being at an academic institution allows me to have the resources to evolve with the times as far as technology and surgical technology, but also science. And I think that allows us to provide the best care for patients. Surgery was one of the last things that I thought I would end up doing when I was in medical school, but I fell in love with it during my 3rd year rotation, and just loved how I could really directly impact people's lives and directly impact a problem immediately. So someone comes in with appendicitis, you take out their appendix, they immediately get better, and that kind of immediate gratification was really rewarding for me. I love being here in Kentucky. I think this is a wonderful hospital, a wonderful place, and I think the patients here are really appreciative of their care, and that makes this job really a lot of fun. But like I say to patients all the time, for me to be able to do the work that I do, it takes a great team, and I think the University of Kentucky has got one of the greatest teams from top to bottom, and I love being here.